Welcome to the Demonstrating Implementation Excellence stream at SNOMED CT Expo 2025. Thank you to IQVIA for sponsoring this stream. My name is Victor Medina. I'm a senior terminologist in SNOMED International, and I'm a CSRM lead LATAM and SNOMED International as well. I'll be your moderator for today's session, and remember, we'll address all questions at the end of the presentation. For our online audience, please use the Q&A button to submit your questions to the presenter. For those attending in person, feel free to use the mic provided in the room when the time comes. It's now my pleasure to introduce, it's a real pleasure to introduce you, Kate Ebrill from CSIRO, who will be presenting Improving Health Outcomes Through Connected Care, Strengthening Standards Capability in Southeast Asia and the Pacific. Kate,
Thanks
your
so
turn.
much, Victor. Good morning, everyone. And this presentation, it's great to follow the James Reed Memorial with Pablo and Jai and Brett this morning talking. And Jai mentioned the work that we're doing in collaboration with AHIN through the Strengthening Standards Collaboration Project. I'm not going to talk in technical detail. I'm all about community, and the most important part around standards is actually the community, supporting collaboration, and importantly supporting collaboration of how we can bring all those standards together for implementation. I come from CSIRO. CSIRO is Australia's National Science Agency. We're a government agency. And, we truly believe that interoperability is more than just technology. It importantly is about the community. And it also then brings that ecosystem together, which is around standards, workflow, decision support, analytics. And we do a lot of work within this space through SPARKed, which is Australia's National Fire Accelerator, but also how do we work within the region to strengthen standards capability. I think, and this program is actually funded through the Department of Foreign Affairs and Trade, AusAid, and we're really partnering within the region to really lift up that interoperability capacity development. I think all of us in the room know that we all face the same challenges around workforce capacity, infrastructure, understanding around standards. So how do we actually work together and build that within our region, within the low and middle income countries in our region? We're all facing these same challenges. So the program was established last year. It's a collaborative relationship between CSIRO, University of Philippines, Manila, and the government within there. We're also really working closely with WIPRO, the WHO, Western Pacific Regional Office, and we're really looking at how we can provide that technical guidance and capacity building. And a massive thank you to SNOMED International, who are supporting us with these events as well, along with HL7 International. So we really are trying to bring the capacity, the collaboration within those standards development organisations, within local region partners within the countries, and really lift up that capacity and expertise. There are so many development partners working in these regions doing fabulous programs of work, but none of them are based on standards. So the program comes in, an amazing program gets delivered, but we really want to ensure sustainability beyond those projects. So how do we help the governments? How do we help partners within those countries have the understanding around these standards, know how to implement them, and then be able to work with the development partners that come in and ensure that when those projects are delivering vaccination projects, child health programs, chronic disease management programs, that programs are actually founded and based on standards such as SNOMED CT and ensure that sustainability beyond that initial 2 to 3 year program. So within the partnership, we really work within the country to understand what are the key strategies and drivers within the country. And within the Philippines, they established an 8-point action framework. And we're able to start to align our Strengthening Standards Collaboration Program against their 8-point framework and start to build up that capacity within Philippines. But importantly, Philippines works as part of the broader AHIN community. So everything we do within the Philippines is also shared broadly within AHIN and across AHIN. So all of the documents, the resources, the trainings, these are all Creative Commons. They're all openly available. So not only can we leverage it within the Philippines, but can leverage beyond. And we're also working with the Pacific Health Information Network, similarly taking a focus within Fiji, but also working across that network. What actually fits within the Strengthening Standards framework? Part of it is around learning. So how do we actually support that localised training? But importantly, not just deliver that one-off course, how do we create a train-the-trainer program? So we have our colleagues from Snowmed International, we'll have our colleagues from HL Civic International, we'll have CSIRO, and we can come in and we can deliver the training, but we can also provide that train-the-trainer so that then working with the University of Philippines, they can create micro courses and start to extend that out across the Philippines. And similarly, that's available across AHIN. We also want to collaborate with industry within those countries as well. To do this, we need sandboxes. You can't just deliver the education without actually having sandboxes. So we're also creating up sandboxes and developer tools, synthetic data to actually enable that as we do this training, there's actually those tools that actually start to enable those boot camps, those connectathons to start to make sure that we are giving that hands-on experience. These FIRE sandboxes and toolkits are there and available. But also importantly, it's all about community. We're all hearing this. It's not just about technology. It's about community. It's about people. How do we actually build that community of practice and make that sustainable? And this is where we're doing that within Australia, within the Spark program. But how do we take that same philosophy around building that sustained community and build that within the Philippines, across AHIN, similarly within Fiji and across the Pacific? So if we can end up with, thousands of people that are aware around the standards, are aware around SNOMED, FIRE, how it works together, and they can start spreading that message out, then it becomes more sustainable beyond just one program that's being delivered. This actually sets the foundation for interoperability across the government. And so a 3-year program, and really we started around how do we build those key foundations to start with. So, SNOMED 101, how do we actually do SNOMED within these countries? How do we stand up fire terminology services? So how can they use things like Snowstorm? How do we stand up fire servers like Happy? And I think the previous presentation talked about the fundamental need to have a fire server and a terminology server. That's what we're trying to do with these countries as well. So how do we get those fire foundations in place around learning these basics? So from that foundation, the next year we start to move in innovation and impact. So how do we start to apply this to use cases like patient summary? There's a large program in Philippines supported by UNICEF around vaccinations. So how do we work with that project to make sure that project starts to leverage the standards for the work that we're doing? And then in year 3, how do we start to expand out and really start to look into those broader analytics use cases? So you can see we're starting to do that basic training. We're starting to support around understanding standards like structured data capture, and starting to also support leaderships and study tours. So things we've been able to do that when Snowmed International provided the training in Thailand and the onboarding, we supported the team of Philippines to go and participate. So trying to get that cross-country collaboration and leverage activities that are happening within the region, and keep doing those fire terminology boot camps and everything as we go. We're also aligning to the WHO SMART guidelines framework as well. So how through the work that we're doing around aligning the use of SNOMED, aligning the use of FIRE, how do we start to align this where they're doing an immunisation program and align to the WHO SMART guidelines? So we're enabling that uplift from, identifying that here's the guideline, identifying the data to support it, identifying how we can actually start to exchange that and move from where it's Excel spreadsheets currently sharing that immunisation information to now linking with guidelines, linking with apps and linking with tools to create more structured data and being able to measure to that point where we can start to analyse that data. But, this is the theme. It's a team sport, and it's really important within the region, how do we bring that collaboration together? I've already mentioned working really closely with Snowmed International to support the training and the boot camps, supporting the Philippines team to participate. HL7 International have also been fantastic. We're providing that expertise and support. Wipro at the table and supporting these activities as well, working with the Secretary of the Pacific Communities within the Pacific, which brings together the Pacific Health Information Network, so 24 countries across the Pacific. And also, how do we leverage open source tools? So leveraging Google Open Health Stack, leveraging Happy Fire Server, and then also bringing in commercial tools as well to show how both the open source and the commercial ecosystem can work together depending on your need and your use cases. And I'm losing my voice after 2 very long weeks. Also, big thank you to AWS because we applied for a health equity grant, which enabled us credits to be able to stand up the work that we're doing on AWS. The kind of common activities we find that are really valuable as we're starting to build out this program is around the Fire 101 and the SNOMED 101. But also what we've been able to leverage is actually using the Snap to SNOMED tools to start to identify what are those local code systems and the local terminologies and how can they start to map to and demonstrate the coverage and value of SNOMED CT. We bring in the fire terminology services to identify how to start to build those value sets, but also importantly, we're using form builders. So the NLM or aid box has also given us access to the development platform. And it's a really great way to start to show how you can take something like existing forms that might be in a spreadsheet or in a PDF document and start to build out those forms that support assessments, that support exchange of information, and have those align and start to build SNOMED CT value sets. So really practical, hands-on activities to actually start to support this. And, huge thanks to SI around providing a development license for SNOMED, because it means within Philippines, who are very keen to be a member, we can start to build some capability in advance and we can start to show the use of these tools. And importantly, as we spread this out across AHIN, they can start to understand the value. And that's been hugely valuable to not just talk about SNOMED, but to allow people to get hands-on and understand the value of SNOMED around starting to populate problems lists, starting to populate medication lists, starting to look at past history. And fire connectathons are so important. I think probably one of the best ways that we've found to start to build capacity is to get clinicians and government and industry in the room together, getting hands-on and actually starting to test through fire connectathons. So we've established Fire Lab, and Fire Lab is a sandbox, and that's hosted on AWS. Thank you to the Health Equity Grant. And that's really providing that toolkit to enable to start looking at that learning and that advocacy and that testing. So the goals around Fire Lab were really to provide a standards-based reference model, also for health information exchange, implementation and semantic interoperability, demonstrate that meaningful use of standards, provide some kind of ready-to-use infrastructure, make it a vendor-neutral marketplace so government can interact, users can interact, start testing, a safe space to promote innovation and test ideas, and really facilitate that knowledge exchange hub. And we really wanted to make sure that from the personas, it would be around technology, those implementers, really important trainers and students. We really want to actively work with the university network across the Philippines, because this is the way we're going to build sustainability in the country. If we can actually start to build up with the medical students and the IT students coming through UP Manila, and they start to understand and they can cascade that out across the Philippines. And then again, these similar models can be applied through the standards interoperability networks or the COIL networks that Jai was mentioning in AHIN this morning. All of this capability is available through those networks, and so we can start to disseminate it out through Philippines and beyond through AHIN. Within Fire Lab, we have the terminology server. SNOMED CT is there to really support that hands-on understanding. These are not production environments. They can only be used for testing, validation and connectathons. Just want to make that clear. We're not standing up anything that will be the production within the Philippines, but really giving that interoperability lab around how all these things fit together. In terms of developer tools around a fire server, a validator, SQL on Fire, how people can understand how we move forward with analytics as well, and also building up that synthetic data to support this. So this is kind of the conceptual model around Fire Lab and the sandbox. Things that we're finding really valuable are really like the postman collections, the ability to build those fire questionnaires and forms. So if you're in a country where you don't really necessarily have EMR systems, but you really want to uplift, I think there's this massive advantage of where people can leapfrog from what's been our 25-year history in Australia, where we have a lot of legacy systems that you can kind of leapfrog and move to being able to start to leverage some of the tools that Fire and SNOMED give you to start to actually build up, whether it's apps that can be used on devices out in community work, or whether it's within the hospitals or the primary care clinics. We can rapidly start to build up some of these forms and services. In terms of impact, in a really short time, we've actually been able to train over 1,000 people. We've been able to develop the proof of concept solutions around immunisation. We started to build kind of 170 plus members as part of the community platform and starting to build up those trainers and build up those development partners across the region and build up that Fire Lab sandbox to support it. But that's been a little bit around what we've been doing with the Asian eHealth Information Network, but we've also been working with the Pacific Health Information Network. And there are 24 countries across the region. Some are Australian territories, some are New Zealand territories, and some are French territories as well, and some are sovereign countries. And within March this year, we actually had a meeting with 23 of the 24 countries. And there was a collaboration, and thank you again to SNOMED International, Wipro, and HL7 International who supported this event. We were able to do a deep dive boot camp with those participants and start to look at what is the benefit and the value around SNOMED and FIRE to start to support connected care across the region. They have those similar but probably even greater challenges that we have within Australia and our community. The country sizes range from 1,000 people within Nauru to 13 million in Papua New Guinea. And then Fiji is probably the next largest site after PNG with 1 million people. So how do you build workforce capacity? How do you retain IT and clinical capability within those countries? And how do we start to engage the clinicians and provide that leadership and apply that to the Pacific? It's really hard within our country of 26 million to do this work. If you're a country of 1,000, where do you start? If you're in a country of 1 million, where do you start? So out of that work, we started to unpack those barriers around just even aging equipment, where they're at, and then also those enablers around how to start to put in some stronger governance health strategy within those countries. How could they start to work together? And they also talked about the enablers if they actually started to take a community-wide approach rather than a country-by-country approach. What could they start to do as a region? And I'm leveraging Sina, who is with the Secretary of the Pacific Community slides here. And what was really fabulous was over that 4-day period, we actually came out with an agreement around strengthening regional collaboration and policy across those 24 countries. Importantly, aligning national efforts with common regional priorities and taking that regional-based approach to the development of a Pacific Core Fire Implementation Guide, a Pacific International Patient, and Pablo did a really great presentation this morning around what's happening with PA4H, where they're taking that across LATAM approach to a patient summary. How can we do something similar in the Pacific across those 24 countries where we start to take that regional-wide approach? And importantly, how could they take a regional-wide approach to SNOMED CT? So that as those 24 countries, as that region, how could they actually take and adopt that terminology and work with SNOMED International? And so I know they've started the conversations and, really fabulous if we can see where we can get to build that regional approach. And then importantly, they could actually establish a regional centre of excellence. So instead of each country having to go it alone, establish that regional centre of excellence where they could bring this capability, said it's a team sport, and it's a team sport of standards working together, it's a team sport of organisations working together, and it's a team sport of countries working together to actually start to get those foundations around connected care. And I will see if this video plays. This is a video that came out of one of our boot camps in the Philippines.
Once we build that whole network, it will be easy to navigate patients, implement projects, plan future funding, and be able to change the course of public health in the country.
And that should be the end. Thank you very much.
Thank you, Kate. And now we will begin the question period. As a reminder, if you're in the room, please use the microphone to ask your questions so that everyone can hear clearly. Any questions for Kate?
They're all protecting my voice. Rob?
Rob Howsam. Is this on? Yeah, I guess it is. So Kate, I, I'm really excited to see all the stuff that you've been able to do with establishing these connections with the Pacific region and then on the connections that they have with themselves. But I'm wondering, is there some suggestions that you have for how we can get them to be even more engaged in the actual process of developing the standards, like in IPS, we're trying developing a global standard, but we don't really hear from this whole segment of the globe. Really, we put out a standard and we hope it works for them and all that, but we need to get more communication going, all the way to the top.
Yeah, no, I agree. And I know that conversations have started between SPC and HL7 International to take a similar approach around what's happening within AHIN and HL7 International as well. And I think this is part of that building of that community and building and strengthening that capacity is creating a level of confidence to be able to communicate and interact within that global community. So we're really encouraging that community of practice at the local level, but how do they engage within that broader region and feed into it? So if we can work through with SPC and the Pacific communities around establishing that region and looking at a Pacific international patient summary, or the Pacific core like we have in Australia with the Australian core, or the Pacific patient summary, then we're building that capacity. We can work with them around building an IG and then provide that ability to start to feed into the international. I think it's really important, but just even being able to get Graham there or getting others into the country, having these workshops starts to build that confidence and know there is a community that is there to help. As we tell everyone, chat.fire.org is like a 24/7 hotline for any question you have about fire. And we really actively encourage people to use that because there is always someone at the end who's wanting to answer and collaborate with questions. So, but we need to give people enough understanding to know how to interact in that environment. And that's really what we're trying to do through this program. So then within the region, they become sustainable and build up that capability within their own countries. And they're not relying on, consultants and stuff to come in and work with them. But yeah, super keen and super want to actually be part of that community. They really can just see the value of being and participating.
Yeah, that's great.
Any other questions? Over there.
A great talk, and I'm James Bunning from London, UK. I suppose my question is about, I think you touched on it briefly towards the end, was about sustainability in terms of how, both in terms of you've got a platform that is non-production, is the tool, is encouraging to pick tools that they can use in the production environment that mirror the way that you have developed your test environment, and also post go live in terms of training. And so, have you got experience, or is that still ongoing? And where to next?
Yeah, I think, within all of these countries, they're actually planning infrastructure development and planning how they actually establish that. So that will be their own kind of ongoing sustainability will be within what they do. But part of this is giving and working with around providing enough training to even understand what the standards are and what you want to ask for within your procurements. Because how do you know what you don't know? To even ask for as you go to procure and establish this infrastructure within your country. So part of that is really building that capacity and understanding. I think part of it is would love to see how something like the Fire Lab Sandbox becomes sustainable across FIN and AHIN. So with the, as Joe was talking about, the community of interoperability labs, this can become a set of infrastructure. It's largely open source tools on there. How do they then sustain that across AHIN and FIN themselves as that ongoing kind of sandbox environment that they use within their countries? And the broader, kind of capacity that we can build with understanding and linking in the universities is the way to go. We're facing the same challenges as Australia. You can see Sparked. Sparked is our fire accelerator, and that's how we're trying to do the same. Build as larger community of people who understand standards. So some might have really deep expertise, and some of the community just might be aware that they're really important and know where to go find that expertise. It's the only way we're going to be sustainable beyond that one project. Is the community will be lasting, the project will finish, but the community is actually what we leave behind.
Well, time is up.
Thank you.
And that concludes this session. So to our online delegates, you're welcome to remain here for the next presentation in the stream, or you may navigate to another session via the event lobby. Thank you, Kate.